Hey, Omer, how you doing?
I'm great, Chris. How are you doing?
Doing really well. Yeah, I've been excited to connect with you.
I am so excited for this conversation. You know, you caught me off guard because usually I get to do well, hey, Chris, how's it going? So, where are you right now?
So our headquarters building is on Marquette's campus, actually at 18th Street. So I'm here at the Blood Center.
For those of for those in the viewing audience who don't know you and don't know what Versiti is, what do you do?
Sure. Yeah. Well, so I first of all love being part of GMC. I've been the CEO of Versiti for 3.5 years. So got here in February 2017. Midwestern kid that's been very excited to kind of have a career that's moved around the world, but always back to headquarters in the Midwest. Versiti, such an inspiring organization. Before I took the role, you always look at what the contribution is to the world, and is it differentiated, and is it something that you can get excited about to do every single day. So for me, folks probably know Legacy Blood Center of Wisconsin, now Versiti Blood Center of Wisconsin, as providing a sustainable blood provision for folks in our local community, so that when they need blood, it's there for them. But when you peek under the hood, there's just so much more to Versiti, and that's what really gets me excited. We're across 5 states, so we're in Wisconsin, Indiana, Illinois, Wisconsin, Michigan, Ohio. Ohio is relatively new. We picked up an academic medical center that wanted to work with us just about a year ago there, so that's been wonderful. But beyond providing sustainable blood supply, we do clinical care, we do research, we do esoteric testing, all of those things centered around blood. So we like to say that we're all things blood, and science and medicine is really core to our mission. And then beyond that, we have the organ and tissue procurement organization here in this area of Wisconsin, so that we're making sure folks on transplant lists get the organs that they need.
Wow. Had I been asked to describe it, I would never have been able to be that comprehensive. And I don't think I understood that you were doing so much.
Yeah.
How old is the organization?
Yep. So the Articles of Incorporation are from 1947. So we're in year 73. And it started with, there's been multiple iterations of the name from the Blood Center that ultimately got to Blood Center of Southeastern Wisconsin at one point. It went to Blood Center of Wisconsin over time. And now, as we've brought together 5 different states, and really Blood Center of Wisconsin had the vision for Versiti to start to bring together a larger organization. You see the hospital systems have been coming together for the last decade or more. And so similarly, being so kind of intertwined with healthcare, we've had the same dynamics that have kind of encouraged us to follow a similar path. And so with that, we wanted to unite the different organizations under one umbrella, but with still very strong local identities, because we were so reliant on selfless donors that donate blood daily.
So this year has been a test of all of our work. And obviously it affects each of our sectors and industries in a different way. You know, you operate in the space of, I guess we'd call it healthcare, but you also operate in the space of volunteer management, of life support. There's so many places where I can imagine you have been affected because the verticals and the horizontals around you are severely affected. But tell me, what's your year been like?
Yeah. Well, 2020 is not one that I'd ask for a redo of. Let's put it that way. It's been a little bit of it's been a roller coaster. You know, I've done a lot of things in my career, but 24-year career, all in healthcare. I can say that blood collection is the hardest thing I've ever done, just because there's so many touch points along the way to inspire someone on that journey, then actually do the collection, process it, get it to the hospital safely, and with a relatively short shelf life. I was in pharma for a really long time, and you turn the machine on, the product comes out, and then it's kind of good for 2-3 years. You don't worry about expiry. With whole blood, it's 42 days. And with platelets, it's only 5 days. So it's just a recurring engine with lots of things that have to go right to be able to serve the community. when COVID first hit, we always want to make sure that we can be there for our hospitals and healthcare systems. And so at the beginning, we saw a dramatic decline in blood utilization. People were off the roads, so there were fewer accidents, there was less trauma. But also a lot of the elective surgeries got put to the side as the hospitals got ready for people to potentially come in with COVID-19 and be able to accommodate them. And so we saw a 40% drop in the need for many of our services there, kind of in the late March timeframe and kind of rolling through April. So we had to adjust on a dime. We've got a part of our infrastructure that's relatively fixed cost. Even the variable cost, it behaves as fixed in some ways because we wanted to do the right things by our people. And so we had to be smart, and we had a lot of conversations with our board around what the appropriate approach was. We've got a great board, highly engaged, have been a part of our mission for a long time. And so those were some really good conversations, but all predicated on we've got to be able to serve the community, and we want to be able to take care of people that have been a part of our mission for so long, our employees. As we got kind of into May, we had to make some adjustments to how we operate. But kind of May through June and now to July, we're seeing that the demand for our services have gotten pretty much back to where they were, not completely where they were pre-COVID, but we've gotten kind of back to where we were beforehand. The elective surgeries have come back. Those things are very important. You probably know this, but elective doesn't mean it's not important. It just means that you can plan it a little bit. But if someone needs a coronary artery bypass, they've got to have it. If they need cancer patient that needs certain procedures, these things require blood, we've got to be there to make sure we can help. So we kind of had a period where we brought down our collections for a period of time. People came out, they were so selfless, they wanted to help. So we saw a lot of donors come out initially in March. And then, there are a lot of constraints on how we operate right now. COVID makes things a little bit harder from the standpoint, we've got to make sure that we socially distance. So we take a lot of pride. It's got to be a very safe environment experience for people that are donating blood. So that puts things in place around social distancing, around the things that we have to do to make sure that it's safe. But some of those things limit your capacity. And so now what we've been managing is initially, we had a decline in demand. Now kind of demand is spiking, but yet our operating structure has a little bit of headwind to it. We've got schools where we collect a lot, but it's unclear what's going to happen in the fall. So that's a little bit daunting. Mm-hmm. Businesses, people are at home. And so we're now working with, some of our GMC members likely where we're trying to say, okay, we normally would collect X number of units because you've been so gracious to help us over the years. If we can't come into the facility, or if you don't have people coming to the facility, then how do we make sure we get folks that have been so caring about our mission in the past to come to our fixed donor sites so that we still have what we need to supply the hospitals when they need it. So it's been a lot. I'm proud of the team though, how they stepped in, and so far things are working reasonably well.
So what I just heard was you have reasonable control over your supply, what we'll say. So you could scale up and down appropriately, but the demand side is completely, susceptible to all kinds of changes. I don't think we would have realized if we hadn't thought about it that the demand for blood would change because folks aren't driving around. And, I think it would be too obvious to us that, the impacts of COVID, at least publicly, have been much more significant on your respiratory system and not necessarily demanding of blood, but the change in traffic, the change in surgeries, that's really quite surprising. What other things could you share with us that wouldn't naturally occur to us as it relates to blood, healthcare, or the ability for you to connect to your constituents?
Yeah, well, I don't want to make this sound easy. It is definitely not easy. The hospital stepped in and really helped us recently as well. So we reached out to the hospitals that we serve, and they were great about running extra drives to help us out. We collect across our 5 states roughly 500,000 red blood cells a year. And we collect that in our fixed donor sites. We collect that in our mobile environment, more in our mobile, let's call it, 55, 60% in the mobile environment, which is going to a hospital going to a place of work or a school or wherever that might be and running a blood drive. So we'll run 12,000 of those drives, give or take a year, about 1,000 a month. And the average size of them, we get 20 to 25 units, but there's some where really big drive, we might get 100 or more. But the point in that picture is that it is a repetitive effort. Any given day here in Wisconsin, 5 to 10 mobile blood drives, we're out and we're collecting. And all those small, I say small, they're all important and they add up to something that's really big so that we can serve the community. Since COVID hit, the cancellations have just been so massive, whether it's, the date doesn't work or the location doesn't work or whatever it is, kind of the chess pieces to make that work have been really, really difficult. So we've kind of relied on the grace of our donors, the grace of folks that have historically helped us to really be flexible and to kind of think with us about how we can be creative, because again, ultimately it's to kind of supply what we need to do. But it's not an easy science.
Sounds just impossibly difficult. So I think I heard 500,000 units annually.
Yeah.
And how many people's donations constitutes a unit? Is that a single person or 500,000 single donations?
Yeah, that's a great question. So we have about, and that's the red cell side. So we also collect over 100,000 platelets a year, but those are collected at our donor centers. I'd put it in the range of 300,000 donors, give or take, every single year, folks that will donate. Average person donates, let's say, between 1.5 to 2 times. I don't want to get too precise with the math, but that tends to be the frequency of an individual donor. We have some super donors that are in like clockwork when they're eligible. But that's kind of the generic math. And it's just it's kind of an inspire and motivate game to keep people connected to our mission and the importance of coming and giving.
So in this moment, we've got so many different levels of macro challenge, right? One of the things that a lot of leaders have leaned on is engaging their employees and their teams around their organization's mission. And your mission is quite literally, it's about saving lives. And so how do you communicate with your team in such a way to motivate their actions and guide your strategy using your mission? What are the tools that you use?
Yeah, well, we talk a lot about blood health innovation. So I'm a believer of blue ocean strategy. Like you kind of go to the place where it's unique and it's the thing that you can do. And what I believe with all my heart is that if Versiti wasn't here, there would be a big hole in how healthcare is administered across the Midwest. We're the 4th largest independent blood center in the United States and the biggest in the Midwest. So that's a big, powerful stake. We track kind of, and it gets hard to do, but we track patient, we kind of project how many patients we think we've touched per year. So, in 2019, it was in the 900,000 range, right? Because all the blood products, back to the red cells we collected, the platelets we did, they're going to have these exposures to patients. We've got dozens, I'll say, of physicians that are Versiti employees. So I'll give you an example. There's a sickle cell clinic on the Academic Medical Center campus in Wauwatosa. Well, Versiti guy, Dr. Josh Field, who's one of the best in the United States, runs that sickle cell clinic, and the care there is exceptional. And the patients that there kind of swear by Dr. Field and his clinic and all the folks that support that. We run the hemophilia treatment center as well. So odds are if there's someone with hemophilia in this area, and maybe even within a 2-hour radius of this area, they may be coming into our hemophilia treatment center again in Wauwatosa. So all of those exposures to us, it's kind of the sum is greater than the whole. And again, it's all things blood. And we're able to recruit, the physician. So back to the science and medicine, I mentioned the Ohio State customer that we now have. That kind of goes back to science and medicine, and they really appreciated this expertise that we had so that we could talk physician to physician to them. And people want to come here because they can do research, because we've got a really strong research organization there. They can see patients because we've got a level 1 trauma center, and we've got a great children's hospital there as well. And they can teach, because many of our physicians, there's cross-credentialing with MCW, which is another just wonderful organization. And so that we've kind of created this brand, this credibility, this reputation. We've kind of continued to recruit towards that. And so that allows us to have a unique niche when it comes to blood and blood health. So I think people get pretty inspired by that when they understand the research we're doing, the clinical care that we have, and you're doing all of the blood provision. Here in southeastern Wisconsin, any hospital you would go to, the blood that they're getting is from Versiti. So I think folks take a lot of pride in knowing that when folks are in those hospitals, they're being cared for by work that we're doing.
So when you operate at such scale, there's a bit of abstraction, right? So when you talk about 900,000 patients or lives who are receiving the product that you collect and you produce, there's a bit of, we're not really good at imagining those kinds of numbers. What's your process for yourself or for your team for making that 900,000 individual humans in such a way that it's really manageable for someone to understand?
Yeah. Well, for the one thing I'm fortunate about, and again, back to kind of making the decision, I always tell people every day you come in, I've got my badge right here. You are making a conscious decision that this is where you want to be. And we've got to make sure that this is a place folks want to be, because it's competitive out there. What I'll say is that, we've got over 2,000 people across Versiti. They are super passionate about our mission. And you can go service line by service line, or you can go to the people that are in our corporate services, our functions. Many have a story. Usually there's a story of something that compelled them to be a part of a large nonprofit organization, but a nonprofit organization that's here truly to serve the community. So I'll tell you that it's not hard to get people fired up about what we do. We see the passion coming out daily. And we start many of our meetings with mission moments, and seeing the mission moment and seeing someone that's been helped by what we do and how grateful they are. And we look at things like Net Promoter Score. So when you read some of the feedback from whether it's a patient, whether it's someone that got a lab test from us somewhere, we provide those lab tests across the country. So maybe someone in Idaho got the combination of a lab result and a clinical consult from Versiti, and you think, wow, like there's a national impact associated with that. We're constantly looking at the feedback, and one of our, our core language, so we talk about blood health innovation is what we stand for, and then in our core language, one of our principles is find a better way. And so in Find a Better Way, it's always about, hey, how are we connecting with the people that are benefiting from our services? What can we do better? Are we listening appropriately? Are we changing based upon what we hear to make sure that we're kind of our level best every day when we show up?
Yeah. So switching gears just a little bit. So you go home, and I think you've got 3 kids?
I do, yeah.
How old are they?
Yeah, I've got a 12-year-old, an 11-year-old, and a 6-year-old. Girl, boy, boy.
Wow. So you're going through a lot of milk.
We do.
Yeah, that's a big grocery bill. How is life with your family? I mean, this is, again, we're learning how to work in different ways. You're traveling in a very different way than you probably have ever before.
Yeah.
How are you managing that?
Well, the kids, we treat them. There's certain times when you have to be the parent and just say, look, I'm making this decision because I'm making the decision. And other places where we have a conversation about it and we want them to think things through. So the most recent conversation, my 12-year-old is adamant she wants to go back to school, right? In our community, they've determined that they'll have an option. You can do an all virtual option, or you can do the option where you get to go to school 2 days a week. Mm-hmm. It's going to be a very different experience, and we wanted to make sure she understood how different that experience would be. But ultimately, my 12-year-old that'll be in 7th grade, she said, I want to go back. And so having those kinds of conversations and understanding how she thinks and the way she's growing up and processing those things has been pretty cool. So she's going to go back. My 11-year-old son said, I'm staying home. Mask all day, every day. I'm going to get put in a group where it may or may not be the people I would normally hang out with. Mm-hmm. we're not really going to go out and do much on recess and play football. I'll stay home, and I can operate in a home environment just fine. And then the 6-year-old, we didn't give him a choice. We just said, you're going to stay home, buddy.
You're just going to stay home. So I, without having met your daughter, I would offer what she's expressing as a desire to go to school is really more likely a desire to get out of the house away from you.
That is very true.
Yeah.
So,
one of the things that we want to make sure we ask everyone about is what have you been consuming in terms of information, content, media, and so on? How are you keeping yourself, connected to the world? We talked a little bit about your social media, but what are you watching, reading, and so on?
Oh, geez. We're, I tell you, it's that stage of life where I'm probably under indexing there. I mean, between the time so what's new in my life, the Versiti part's always got to come first. And I've joined the board of Arthur J. Gallagher, which is a wonderful company that's listed on the New York Stock Exchange. But that just happened in March. And so have not actually been to a live meeting yet. So it's been interesting kind of onboarding into that. So that consumes time. And then sports, which some of my friends that are in different states, they can't believe what we've been able to do here. But my son just finished a 50-game baseball schedule.
Wow.
Where they were all over the place. We were in Illinois this past weekend for a tournament. And we do a lot of training together at home as well. So first thing I would say is that probably is consuming between those responsibilities, it's consuming quite a bit of time. There are certain things that, I've signed up for that I get ticklers on a daily basis. I try to kind of skim the headlines for the Wall Street Journal to just see what the top 10 items are of the day, and if there's something I want to plug into. Korn Ferry, when I was with my last employer, was someone that we would bring in that we did really good work with. And so they've got some things that they publish that focus on leadership, because really for me, kind of leading through the pandemic has been something that you want to make sure you're doing everything you can for your people and your organization. So I go there. If I were to turn the TV on, CNN a bit. Sports first, just transparently. Yeah. Sports first.
You're an athlete.
I'm an athlete. That's the thing. So lots of sports. I've added kind of CNN though to my Twitter handle. So between that and on TV, at least kind of get a sense of what's going on in the world. I try to stay out of the way of. I've never been an overly political beast. I kind of understand the issues, but for me, it's more about, hey, what unique contribution can I make, can Versiti make, and that I can do to raise, with my wife, 3 kids that are going to do great things. So I try to put my energy in these places where it feels a little more controllable and where you can kind of see an outcome more quickly.
So I'm going to make an assumption about you as an athlete, and you played at a level that is inescapable. You will forever be an athlete. I'm going to assume that your management style is like a coach. Is that a fair assumption?
Probably fair. Yeah.
Okay. Fair. So thinking about this conversation that we're having with all of our GMC members who represent, the leaders of our community, many of the most important leaders of our community. Wearing your coach hat, how can we make the best out of this moment? Our collective attention is focused on improving Milwaukee on so many levels. So, Coach, what should we do?
Yeah, well, and I'll maybe get to the side of not completely into the social unrest, but kind of how that's translated to kind of how I think about things. Back to, you want to lift people up. So what I would just offer people is, what can I do either today in the moment to be really present with someone to lift them up that maybe has a different view from me or looks different from me? And then what things can we do over time so when we wake up one day, it looks really, really different. So I'll give you a small example, like with our service lines that, we'll do periodically. I'll spend time with our service lines. Our organ and tissue procurement service line is so inspiring what they do. It is really hard work that team does to kind of deal in high stress environments, but yet sure that we're getting organs to people that need them. We don't have as many Black nurses as we should, given the number of Black organs Black and brown organs that we collect and that we need to collect to serve the community, because people are on those waiting lists longer. If you're an African American, right, you're much less likely to get the organ that you need. So we just start having a conversation of what can we do to have a base that looks more reflective of the community. And so the idea that we came out with is we're going to create a nursing development program. And we're maybe going to hire a little bit differently. There's a standard way that we would hire with certain experience that we would expect to bring someone in to do the type of work that we do, because it's not perceived as an entry-level nursing job. But we started to figure out that, well, wait a minute, if we're really serious about having a different mix, we've got to do something different. So maybe we create our own program. It's a development program. We invest in an incremental couple of roles. We train people quickly, and we connect them to our mission kind of right away. So that's an example. We've got a ways to go. We've signed the pledge with the MMAC, but the work is in the day-to-day effort. And so that's where, our focus is: how do you develop people one at a time? How do you create a mentoring environment? How do you create progression and reason to believe? And I think as a city, I'm not the expert to figure out how to get this completely right. I know a lot of smart people are thinking about it. I always go back to education and kind of go into the folks. If you're thinking about the future, then what are specific things we can do with folks that are kind of high school to college age to enhance their readiness and likelihood of staying in Milwaukee and being successful when they get done. And that requires an investment. But from our standpoint, that's where I want to take Versiti, is to start to make more investments in those kinds of areas.
So you didn't use these words, but what I just heard you do was a couple things. One, I heard you invite GMC members to participate in you diversifying your nurses and your staff. And I also heard you volunteering yourself to share your insights as it relates to doing things different in order to generate different outcomes. Because I think we only get there when we can do so collaboratively. And I'm excited for you to lend your voice to that conversation, and also hear the voices of so many other GMC members. So in closing,
sure.
A few minutes ago, you described the evidence of your team's connection to your mission. You said that everyone's got a story. So I'm going to ask you, as we wrap up this conversation that I'm so glad we got to have, and thank you. Yeah. Share with us, what's the story that motivates you doing your work?
Oh, wow. Well, I got into healthcare. It's a positive story, but I got into healthcare because my sister's 7 years older than me. I almost never met her. She went into a diabetic coma when my mom was pregnant with me and nearly died. And she was type 1 diabetic, but back in the 70s, they didn't always pick these things up as closely, as quickly as they should. So I grew up watching her give herself, 3, 4, 5 injections per day with this box of insulin that sat in the refrigerator. And every time I opened it, I saw that this was what was saving my sister's life. So that's why healthcare was so important to me. And when I got into, when I graduated from Butler, I went to Lilly, which was 6 miles away. But they made insulin. They had a big diabetes franchise. And so it was very personal, and career kind of went from there. I just can't imagine myself being doing anything else but healthcare. So that's inspired me. And I'm hopeful that we can do things so that when my kids are my age, something will be different because of the things we're doing today at Versiti.
I love it. That was a fantastic example. Chris, thank you so much for giving us some part of your day. And I look forward to seeing you, hopefully, person to person very soon.
Would love to. I'll buy you lunch. I'm starting to figure out the places I like around the city. So when we can, we'll do that.
We're still recording, so there is evidence of that. I look forward to taking you up on that offer.
Great. Thank you.